let's get started, scholars and colleagues. So I know that we made an acknowledgement before when we were with Tori. This is a specific acknowledgement of country because we're in a particular place right now. Just acknowledging that we're always on country, always, wherever we are, even when we're in a building, right? Country is a place of teaching. Oh, it's gone back. Let's go forward. No, let's go back. That's it. Country is a place of teaching, learning, research and scholarship. We acknowledge elders and ancestors of country where Flinders University campuses are located. We are meeting today on Kaurna Yata, Kaurna People's Country, and where Flinders University's first campus was established. The Bedford Park campus, where the teaching and research staff primarily work, so we primarily work there, is located at the foot of Nanu, Kaurna ancestor. The red kangaroo rock beneath us here at Festival Plaza is the place where Tanta, the male red kangaroo Kaurna ancestor, introduced initiation ceremony for Kaurna men. During the early days of colonisation, the rock was extracted and used to construct Government House, Parliament House and the Adelaide Jail. Finally, we acknowledge Aboriginal and Torres Strait Islander peoples attending this session and that Aboriginal and Torres Strait Islander people's sovereignty was never ceded. So you're always on country, and I know I said that before, but that's something you can take with you today, thinking about the history of the country that you're on, the contemporary context of country. Okay, so welcome. We've got 6 health science students and then we've got our team of colleagues here today. For those of you who were in the session just before, I already introduced myself. I'm Tracy Ann Rankin and I'm here with Jane Harford and we're here with our colleagues today. Have you encountered any barriers to getting your essentials sorted? If not, cool. If you did, totally normal. Because this is a whole new system, right? So having barriers is not necessarily a you problem. It could be a system problem. And we can help you with that. One of the things I thought about when Tori was talking about level 2, I was like, how do we remember that? And then I thought 2, there's you and then there's the person that you have to talk to. So that's another way of remembering level 2. There's you and then the person who can help. But there's also us. There's us. We're here to help across the year, across the years. And self-advocacy is a really important skill to have as a student. It's a really important skill to have as a professional as well. Some of the things that you might have encountered will be covered in this session as well. Okay. So the kind of things that we'd like to hear from you about, so we're going to have a little bit of a discussion. Maybe we've already had this discussion at our tables with the scholars.
Well, we've made a start on the first.
Yeah, we've already had a bit of a chat about, have you enrolled in your topics? Have you enrolled in your topics? You think, yep, great. We're going to get you to talk about why you chose the area of study that you chose, and we might invite our colleagues to come over and be part of that. How does the degree reflect your current and future goals? I know you all have goals because we've talked to you about those. What is something you hope to achieve during your degree? So it might not just be to become that future professional. It might be a set of skills in relation to that. So a student that was at the Bedford Park session yesterday said to us, they just want to not be scared about studying. That was one of their goals. And I totally get that because doing something new can inherently be scary. We also want to make sure that your choice of 3 option topics support your goals, and just making sure whether or not you might need to reconsider those option topics if they don't completely align with your goals. So we're going to talk to you about that at your table just as a start, and then we're going to get on with a little bit more. So, cool gang over here, cool gang of colleagues. Do you want to come and sit with some of our colleagues over here, our scholars over here, I should say, to just get a sense of especially these, what do you want to achieve? And how does your degree sit with your current and future goals? You know, actually we have new academics with us as well. So you might feel new as students, but some of the academics are new too. So everyone has new moments in their life. I'm just going to turn the mic off so I can let the tables chat about things.
Can I just add one thing to the enrolment, and that is making sure that you're also registered for your classes for each of your topics as well. So there's 2 steps to that process.
So there's enrolling and then there's making sure you're in a tutorial, or a lab, or workshops. Okay.
Why don't I just float and be a troubleshooter?
You can do that. You're an excellent troubleshooter, Jane.
Somebody described me as sage yesterday.
Or maybe
What is everyone?
Or nutrition.
Or maybe nutrition.
Okay. So you made a good choice with health sciences. You just do like a smorgasbord and be like, okay, what actually sings to me and what is not what I thought I was signing up for?
I'm a physio myself. So I did the health science program and then the master's.
That's what we. Oh, there is another degree coming next year.
Yes,
That's what we might transition into if we get a good GPA in the first semester.
They pay off the guaranteed.
I'll
do this. You get a good score.
What subjects are you?
Move, and if not,
Intro to physio,
I like it here, and I feel
bioscience,
through here.
nutrition, and research. Research.
Skills.
Yes. So,
My name's Rafe.
I'm John. I'm Noah.
I actually have stuff and I want to help other
Just.
people. So I did Googling.
I think I'm doing the
I will
nutrition.
eventually finish my degree.
Yes.
You'll probably be doing him
And with that,
this as part of that, and you'll definitely be doing research and studies.
Yes, I am.
Yeah, because that's like a
masters of OT.
go elsewhere.
So it's all
Yeah.
it's a little complicated, but
So
I'll be helping.
you've got a few alternate goals, Noah. Is that right? Depending on what happens, you'll see.
It just kind of depends on
That's what I was.
What you
like from
What is something that you guys
because I did for my research project a couple of years ago. I did my research project on the nutrition.
Would love
And
to.
then before
I
that,
think
I
that's
went
like
through
my
physio,
number one goal.
and then paramedics has come up
just like-
recently,
Yeah,
so it's
right.
kind of like a
Good.
What's exactly
attracting women? Apparently, I don't know my age. I turned 29.
nutrition and physio both kind of
And
similar.
I have always
pretty
stuck
sporty. I
with
do
studying.
sports
So
stuff.
even just to get
And
through
kind of
foundations, yes,
It's
it's
working in that, and then
like,
paramedicine is just helping people. There's always like a need for the job.
So
and
now I guess
it's
to
the
get
satisfaction
through the
in
rest of this year,
kind of
and
finishing
be
and
like,
helping
no, I
people.
can do it.
But all of those.
I feel like once you start studying
Yeah,
things
yeah.
that
Yeah.
you love,
One just has a
way easier.
primary
Yeah.
role,
And
and the others might have.
100%.
ongoing
I feel
role.
like that's probably the drive for all of us is like, I remember the moment when I was in first year and I was sitting in my human bioscience lecture and just like
Throw another
listening to
bomb
all
in
the
there.
topics
Have you
and
thought
then
about
like
exercise
the module on the
physiology?
reproductive system and I was like, that is my drive.
What would the difference
I ended
between
up
that
doing
and
reproductive
physio sort of-
biology and then
Sorry, I just know that the physios I know and the exercise physiologists I know that when they get asked that question, which get asked that question all the time, they get very cranky.
I think
it's hard to
pathway whether
kind of
it is your original trajectory
say the
or
exact difference, to be honest. So I'm a physio in pediatrics,
Yeah.
so I don't have as many.
something you hope to achieve.
To do something
From my understanding, it's very similar in terms of training of like exercise prescription, how to help people through their movement, rehab, do peds through to aged care. Physio is a longer process to get there. We have a lot of ex-phys students then,
So I wanted to come back and do something
do Masters of Physio to kind of finish off there.
So exercise science is that they, I guess you prescribe exercise, they can administer it, but they can't prescribe it. When you do the extra, which is the exercise physiology, it means that you actually have that additional, and just giving myself enough knowledge to actually be able to prescribe exercise for chronic disease, as opposed to for maintenance of health, which is exercise science is maintenance of health, and I think of similar to nutrition, a nutritionist versus a dietitian. The nutritionist is maintaining health through nutrition, whereas a dietitian is helping use nutrition to treat disease or to manage chronic disease. So exercise phys versus exercise science are very similar as well. I just know when you mentioned that you play 2 sports, I know that a lot of our exercise physiology team
when I was finishing
0.5 as an academic and 0.5 as a head coach for hockey and in SASI and that sort of stuff. So another, just to throw another one in there.
We have lots of sports.
Nursing has already shaped more.
So a couple of
Otherwise I'd be
taught but coordinator are looking to become
rehab.
elite sports people, but I'm like, physio is my backup plan.
Yeah, some income,
Yeah, that's right.
Yep.
So that's not bad either to have multiple,
The other thing
things.
with your sport, and it's just me with my student success hat on, is that depending on the level that you're representing at, that you can apply for elite athlete status, which gives you just flexibility in just if you have to go to competition or you're in, I never got the ads or whatever.
Oh yeah, it's so good. Yeah, I had mine as well. Undergrad.
You can just Google it on the Flinders website and see if you fit in, because it does depend on the level and when and how.
And we're all doing the
We have like,
yes, and research and study, and then I'm doing nutrition.
We did have a student who was a Paralympian.
yeah. We had a Paralympian.
And I had a Taekwondo.
Yeah, and we had, and they were like, sorry, I won't be up. No, they were like, sorry, I need an extension. I'm going over to wherever the Olympics are.
So that's generally like
And I was like, does that mean you're an Olympian? And they said, yeah. And I was like, why didn't you just say that?
Research.
We have people who are not Olympians.
Psychology
as well.
I'm doing 2, so I'm doing 4.
All over their own feet.
Yeah, I'm one of those people who's not anywhere close to being a sports person.
Yeah, so
All right.
in this session we'll just
Check to see.
That's okay. That's all right. I think we've kind of covered. Do you feel like you're in the right option topics? Maybe you're not thinking about option topics this semester. You might just be doing the core topics.
Listening to what people are enrolled in, and I'm going to give some advice about option topics to everybody.
Yeah, great. Yeah.
Thank you, Jane.
Just in terms of thinking about credit for people who do end up in one of the allied health bachelor's degrees next year.
Okay, great.
Other ones you did, like introduction to physio.
I also saw you on the HDR stuff.
The pick versus the ones that
So I'm doing my HDRs. I saw you on one of the
You can do
panels.
any of these ones.
I think so, on a video somewhere.
Okay, great.
Oh, okay. I've just seen you, I feel like I've seen you around.
Oh, yeah. Okay, coolio. Thanks, scholars. Thanks, peers, and thank you, colleagues. We're actually a very diverse bunch. Actually, that's one of the things that's so excellent about health sciences, that we're extremely diverse bunch of peers.
I didn't actually introduce that.
I know. We can do that.
That'd be good.
Yeah. I'll pass the mic around. How does that sound? I just want to see what our new... Yeah, let's pass the mic around before we get to this part. So everyone's already heard from me, but I'm the acting first year transition coordinator. I've taught for a very long time in strengths-based approaches to health working with Aboriginal and Torres Strait Islander peoples. Jodie's working in that topic too. And I'm also an activist in reproductive justice. And I like to think about big ideas a lot, which annoys people and also endears them to me as well. Roweda.
Okay, so hi everyone. I'm going to stand up so this way I'll be able to see everyone. So welcome to your degree and to Flinders. So I'm Ruwaida Slim. So I coordinate just for city campus availability, human bioscience. Do you want me to introduce the topic as well?
Well, you can come to do that when we talk
Later
about
on?
it. Yeah,
okay.
yeah.
So I'm Ruwaida Slim. Nice to meet you.
Yeah, but what else do you? What else are you interested in?
So I'm interested in terms of safety. And that's why this is one of the hats that I've got at the College of Health and Enablement. I'm the lead of safe and inclusive environments. So I want everyone, whether staff or students, they feel safe, respected in all the measures, whether safe at school or in this case, on campus, during your session. You've got the freedom as long as you're respecting others to say your vision, your view, your opinion, as well as to make sure that you're not impacting others by your opinion. And you're going to find when we're going to run a human bioscience, we're going to maintain that you need to gain consent from your peers before you're going to do any activity or touching them or whatever, okay, such as measuring the blood pressure. So this is in terms of activist in terms of safety, sexual health, okay? Nice to meet you.
Thank you, Ruwaida. And I just met Hannah today. But it's so lovely to have you here, and I'll let Hannah's introduced herself to this table, but I'll ask you to introduce yourself to everyone.
Sure. Yes, so my name is Hannah. I am a physiotherapist and I work just with paediatric populations, so from infancy through to sort of that 16-year-old age bracket. So I still clinical practice about 2 days a week, and then I'm a PhD student here as well, looking at technology in peds rehab, so robotic assisted gait training specifically, and robotic upper limb training at the Women's and Children's Hospital, which is really convenient with City Campus because it's right over there. So my interest is peds, tech, robotics, and I'm the TC for Intro to Digital Health, which should align nicely.
I think most people met me at the welcome, but if you weren't at the welcome, I'm short. I'm Tori Llewellyn. I'm a pharmacist. I've been in the health sciences team since just before COVID, so if you think your orientation is rough, I arrived in a week of 2020 in semester 1, just before everything closed down and went a bit crazy. I have previously been involved with Health 1010, which is the research and study skills topic. I teach the pharmacology in midwifery and in optometry with Jackie, who's sitting over there, who, as she said, is in week 2. And we're actually just about to start designing a postgraduate topic, a couple of topics for nurse prescribing. So we're the drug people in the college.
Drugs. Hello. I'm going to quote that back at you. Hello.
Where are you? You got it. Go for it.
Hello, everyone. I'm Jackie. So as Tori said, I'm quite new. I'm new to Flinders, but I've been teaching pharmacy practice for about 8 years. So 5 years in Monash University and then Adelaide Uni as well. I'm now just starting the lecturer role, obviously, in doing pharmacology, and anyone who can prescribe basically is what I'm interested in. So I did my PhD in pharmacoepidemiology, which is the study of how we use medicine and what are the outcomes from how, as a population, how we use it. So, so that's why I'm quite interested in teaching pharmacology and how to prescribe safely and effectively so that we can improve our health system, because medication error is just a big area of a problem for us. Because if it was the amount of error that we get from prescribing, for example, and how some unsafe practices, if it was aviation, we'd be seeing like planes falling off the air every 2 seconds, basically. So we've got a lot of work to do, and that's why I'm really eager to sort of teach other prescribers, so nurse practitioners, optometrists, midwives. So if you're not aware, they can prescribe. So that's why I'm getting involved in those topics. Yeah, thank you.
Hi everybody, my name's Jodie. I'm not a TC this semester, but I do tutor into 10-12, which is the strengths-based approaches with Tracy Ann. And I also come in, I think, week 6, 7 or 8 on 1304, the communications topic. My background is social work. So prior to coming to Flinders at the start of this year, I worked for the state government for quite a while, working with people in youth justice with exceptional needs, so people with multiple complexities that have been failed by the system. Used to come in and service coordinate and basically kick people up the bum and tell them how to do their job properly, and also to embed Aboriginal and Torres Strait Islander perspectives in health and get them to consider treatment plans outside of the regular box, because one thing you'll find out is that a lot of the assessment tools out there are designed around a 40-year-old white male, and if you are not a 40-year-old white male, you will very highly be over-diagnosed or under-diagnosed. So I was doing that for a long time, and then, so basically teaching them how to do their stuff, and then I thought, well, rather than me trying to break bad habits for people, how about I go back to the start and get people before they've hit their careers and start building these ideas and stuff for them, and it's also a passion project of mine because I've also then navigated a system not only as an Aboriginal person, but also my son has cerebral palsy and epilepsy. So again, trying to fix the system, it just never works. So I thought we'd just come back and start from the start.
A terrible spot. Yeah. Hi, everyone. My name is Georgia. I'm new as of January to Flinders University. I was previously at Adelaide University. My passion is human biosciences, human biology, human physiology, how the body works. My PhD was on food intake regulation in pregnancy, so I started preclinical in mice and translated my findings into a clinical setting. So I won't be your TC, but you will see me in week 3, I think, helping out with your human biosciences workshop. So I'm sure I'll have some random pregnancy fact, nutrition, gastrophysiology fact to throw in there somewhere. But yeah, super keen to be a part of your week 3 workshop, and I hope you love each of your topics and each of your degrees.
Thanks, everybody. Jane.
And so I'm Jane, and I introduce myself in the room as your course coordinator and also topic coordinator for HLTH 1306, Understanding Health and Illness and Health and Social Care in Australia, which I don't think any of you are enrolled in, but given your goals, that's fine. Okay. My background is that in a previous life, that's before most of the people in this room were even born, I was a registered nurse, but I didn't stay in nursing for very long, and I very quickly moved into health administration. And when I was studying my health administration degree, in my 3rd year I did a topic in public health, and it was like that was, I heard Georgia say, when they started talking about the reproductive system, I thought that's my jam. It's exactly the same thing. If any of you have seen the Blues Brothers movie, no. When they're in the church and the light shines through the window and Jake does his somersaults down the aisle, that was my experience. So I pursued further study in public health, but while I did that, I worked in a public hospital in an administrative role, basically managing the medical staff, but also doing the administrative stuff, not the clinical stuff, for the medical staff, and a bunch of other roles in working with other people in the hospital to improve the way that the service worked. Really important role in health systems that doesn't make it in a flattering way to the storylines in Grey's Anatomy and ER and
The Pit.
The Pit, yeah. Usually the people who are in those roles in those shows are painted in a pretty poor light, but they do a really important job. And then worked for the Commonwealth Government in their aged care program, so I was involved in administering policy, working with community organisations who were interested in being service providers, to develop proposals to be funded by the Commonwealth Government for the services. And then I moved to university full-time and been here for 9 years, and before I worked here I was in a dental public health research unit at Adelaide Uni, looking at access to services primarily in relation to oral health. So I bring all of those things, so it's sort of I can think like a clinician if I need to, but I also have a really broad understanding of the health system and things outside of the health system and how they interact and how government and policy sort of impacts on how well the health system works and what the opportunities are. And I can even quote the relevant sections of the Australian Constitution. So that's me.
Thank you, Jane. We are actually all of the academics, my peers, are nerds in our own ways, which I love. I love to hang out with nerds. But one of the things I wanted to draw on from what Jane just said is that the health system and health provision and health care, there's so many people who aren't doing clinical roles who actually play really fundamental roles. And so, as Jane said, the clinicians are seen as the stars, right? But actually, we want you to think about other roles that you could do as well, beyond the clinical roles. And we might talk about that. This is just very quickly, having a study plan. Having a study plan is a really important way to become a student, and a student is a role, it's a disposition, it's a way of being in the world. And for a period of time, you're going to be a student. So working out how to be a student is really important. So one of the things you can do is map your study schedule. We already kind of talked about that, but having done that is really important, or doing that is really important. Mapping your timetable, making sure that you have scheduled those classes that need to be face-to-face, or labs, or interactive online sessions, making sure they're in your schedule. I know that Tori's already talked about this. There are key dates for the whole university, and Tori talked about those before. But there are also key dates in each of your topics. So key dates are when things are due in. But they might also be things like when you need to meet with group members for a group task. So if there is a group assignment, making sure that you are mapping the time that you need to put into that assignment with your peers. Think about what the requirements are for each assignment. Now, a study hack, which comes from those of us who've studied before, who've been in this space for a really long time, count back at least 2 weeks from a due date to give yourself the time to complete assignments effectively and to seek support if necessary. Support is multifactorial. It might be, I don't understand this assignment. What are you asking of us? I don't really get it. Asking for support to unpack the assignment further. It might be, I'm really struggling generally with my studies. I feel like I'm a bit overwhelmed. That is not unusual. It doesn't happen for everyone, but it does happen for some of us. So seeking support before something's due in is a really great self-advocacy skill, and it's something that you may need from time to time. So knowing when something's due, what the key dates are, allows you to do that work that you might need to do and do need to do before an assignment is due. This last one I think is actually really important. Map your time. When are you going to study? So what days of the week? What parts of those days of the week? And when will you get chunks of time to study? Because there'll be times when you're working on an assignment, or you're having to do a reading, watch some lectures and so forth, and you're going to need to sit down and really put some time into that. So getting a sense of when to do that is part of how you create a study schedule. And it's a really important way of developing the disposition of being a student and the habits that are important to becoming a student. Have you got anything to add, Jane? Okay.
I'll reiterate the at least 2 weeks.
At least 2 weeks. 2 weeks is my time, but yeah, at least 2 weeks. But knowing when things are coming up is very important. Okay, this is kind of like, what do we mean when we use these words? And you'll hear us using these words so commonly because they're common to us, but maybe they're new to you. So what do we mean by topic? So at Flinders University, a unit of study is referred to as a topic. A topic is a specific area of study like a subject. So for example, in Hannah's topic, which is Health 1011, Introduction to Digital Health, It explores, this is the subject, it explores the role of digital systems in health and healthcare. Students are introduced to a range of topics on the use of digital systems in the healthcare system and the application of digital platforms in health and healthcare. Did I read that right? Yep. So this is telling you what this topic is. This is what this topic is about. Every single topic has learning outcomes. You might see that written as LOs sometimes. And the topics assessments will reflect the intentions of the learning outcomes. So these are the learning outcomes for digital health, introduction to digital health, and the learning outcomes and the assessments will reflect themselves back at each other. So the assessments reflect the learning outcomes because the assessments are assessing whether or not you're meeting the learning outcomes. Every topic has a coordinator who supports and leads the topic. In relation to this topic, it's Hannah. So coordinating and leading, Hannah will be the person that you go to if you need to seek support. And then Hannah might say, I can help you with this and this, but you might need to also seek this support elsewhere. Topics have a mixture of lectures, workshops, readings, short videos, short texts and activities to support you. So this is specifically for on campus, but online is similar, has a mixture of lectures, readings, short videos, short texts and activities to support your learning. So this is what we mean when we're talking about a topic. Any questions? Nope. Okay, let's keep going. Okay. Every topic has its own Flow/Canvas site, and this is where all the learning content can be accessed. So I heard a scholar saying that you got an email saying Module 0 is ready. Had anyone else get that email? At least 3 scholars. Have you checked your Flinders University email, scholars? Well, maybe you're in different topics, so it's okay. But when you get an email that says Module 0 content is ready, Module 0 is sitting in this place called Flow or Canvas. And every topic has a Flow/Canvas page. It's the learning management system. We call it LMS when we're talking really quickly or writing an email to someone. But the learning management system is where we hold the content for each topic. And Flow and Canvas are interchangeable terms, but they mean the same thing in our context. So one of the things that you'll notice is that the Flow or Canvas topics are consistent in how they appear, not exactly the same, but very similar. And this helps you to feel a sense of belonging, which is a key concept. We're going to return to that later. And self-efficacy, which is the ability or the belief that you're able to do something well. Another study hack, and I said to the scholars over here, this is really important for us as the teachers. Explore the topic's site and get a feel for the topic's architecture, so how it looks, how it feels, how it presents itself, the logic of the site before next week. Learn about the topic expectations and how to access the topic's contents and assessments. So doing this, having a look around, having an explore, will support you to develop an understanding of what is expected of you as a student in the topic. That doesn't mean you'll understand, everything that's going on, but you'll start to get a sense of it. You're going to say something, Jane?
I was going to wait till you finish. I'm sorry, I should have waited.
I've finished.
For most of you, there'll be an expectation that you'll have done some work before you go to your first class next week. So have a look. There'll almost certainly be some reading, maybe some questions to think about answering, so that when you go to your first tutorial or workshop next week, you're ready to hit the ground running with the learning activities there. So there'll almost certainly be some recorded presentations for you to watch. We don't have lectures where you sit in a room and get lectured to. All of that material's recorded and online. So when you arrive at your classes, the expectation is that you'll have looked at that. And when you open up a flow site, and we'll have a look at one in a minute, you'll see that it steps you in a particular order through doing some work yourself, going to class, and then thinking about revision and review. And can I just also add, FLOW stands for Flinders Learning Online.
Yeah, we've got all these acronyms. You know, when you're at high school, whether that was very long ago or not very long ago, they have acronyms for everything. And I remember my children coming home and going, yeah, I'm doing my BBLLO. And I'd be like, what is that? Yeah, we have to do that for EEFIOG. And I'm like, what? So every system has its own weird acronyms. And we get used to using them, but then we realise not everyone understands what is flow. Anyway, so you'll start using these now with a BLOM as well. I think we've kind of introduced most of ourselves, but we can just quickly say what the topics are about. John and Beck aren't here today with us because they're both unwell or looking after people who need their care. But we can just quickly give an overview of what these topics are about. So, Georgia and Rowena, do you want to quickly talk about human biosciences? Also known as, do you want to nerd out together?
Thank you. So hi again. So in terms of human bioscience, you're going to find that I'll be the TC for City Campus, Georgia, and also we've got as well another TC, her name is Bianca, will be the co-TC for STIRT and online availability. And one of the things we ask students that when they're going to contact us, that they use a human bioscience at flinders.edu.au, which is going to be a shared email. One of us will be as well responding to your email. And make sure, because if you're doing the topic at City Campus, within the subject, make sure you write City Campus, and then in this case, it's going to be that I need to be, let's say, the one responding to your email. Now, in terms of a human bioscience, what exactly it's going to offer you? So this topic, it's going to provide you with the foundational knowledge regarding the human anatomy and physiology. So in this case, we're talking about the body structure and function, and you're going to find that every week, except week 1 and 2, will be covering one of the body systems. So in this case, we're going to have a few weeks, 1 week covering skeletal, another week covering a muscular system, another one about cardiovascular, respiratory, and so on. And one of the interesting things about this topic that you're going to find that we run heaps of hands-on activities, and you'll be able to do self-check as healthy checkup on yourself. So in this case, sometimes you'll be able to do blood pressure, check your blood pressure, your blood glucose level. You'll be able to do ECG. You'll be able as well to check your eyesight. So these are some of the activities we run in this topic. Now, on yesterday, I sent you a welcome message, making it clear that before we're going to start next week, to make sure that you access Finding Your Way, and as well Module 0, which is about completing your induction and code of conduct quiz, and then the other modules will become available. And you're going to find every Friday, I'll be sending you an email highlighting what stuff you need to cover for the next week. Okay? You want to add?
I feel like my best advice is just to make sure that you've attempt to watch the lecture content before coming to your labs. I'm pretty sure your labs are on a Thursday, so it gives you plenty of time to watch them and kind of let that information sink in. It will be much easier for you to, I guess, be more hands-on and, ask questions when Rowena is around and interact with the peers and the specimens or models that we have on display if you have that prior knowledge before coming in. Have some fun. It is an awesome topic. You'll probably, every single body system is amazing, but hopefully you gravitate to one, reproductive system, or maybe digestive. It is really awesome, guys. So, really keen for you to hit the ground running.
Yeah, and as Georgia mentioned, during week 3, she'll be running the session, okay? So you'll see her again as well. And the session will be about the respiratory system during week 3. And one of the things maybe before I'm gonna finish, do you know how many bones we've got at the level of, do you know what's this one? Is it your arm or your forearm before? Forearm. So how many bones do we have here? Okay, how they look like? Are they parallel? Are they on top of each other or not? Parallel. Okay. So what do you think gonna happen? So in this position, it's gonna be supination. What do you think gonna happen when you're going to do pronation? They cross. And if you want to feel it, put your fingers on these 2 bones and try to go around, and you'll be able to feel, yes, your radius bone, in reality, it's on top of your ulna. Okay? So this is, if you want something fun fact.
You'll learn lots of fun facts. Lots of fun facts.
Okay, so get ready. And this is a human bioscience, so hopefully you're going to enjoy it. But one of my main, let's say, tips, make sure that when we're going to be always sending you announcement, you've got a Flinders email in case you are not aware where to access it. If you go to your Okta, you're going to find there an Outlook. This is where you'll receive the emails. So I had the students last year, they didn't know that when we're sending them emails, they were checking the Gmail. But in reality now, your email will not going to go to the Gmail. When we send you an email, it's not going to your Gmail, it is to your Flinders email. Okay? And feel free always to ask questions. Don't feel shy now. Maybe it's going to be a silly question. Or no, nothing is done. Nothing is silly. Always ask questions. We are here to support you. We're not going to be able to know if you are struggling unless you're going to tell us. And all the best.
Thank you. Thank you. Everything is about systems. Basically, isn't it? Some of them are body systems. Some of them are systems that are human-made, like the health system. I was going to say something else. The body's just very cool, the way that it works together. It's mind-blowing. We won't talk about that now, but we can talk about it later. I'm going to ask, Tori doesn't know this is about to happen, but Tori is an excellent pivoter. So I'm about to ask Tori, could you speak on behalf of 1010? Because you used to be the topic coordinator, and so you're very au fait with its role. So 1010 is the research and study skills topic. Thank you for pivoting.
No problem. So Health 1010 Research and Study Skills, it doesn't have a very exciting name. It will soon. It turned out that we have Research and Study Skills 1, 2 and 3, and nobody really communicated with us originally that those were holder place names. And so that was back in 2020. 2021, this topic started, and they haven't been changed. So apologies, because it's really not that exciting.
A name.
Yeah. The topic itself is, because what it does, and the reason why it's on all of your study plans in your very first semester, is it's literally setting you up with all of the different academic skills that you are going to need in all of your other topics going through your degree. So it's something we call a transition support topic. It's helping you to get settled into this craziness that is university study. So the focus is very much on supporting you to identify areas where you might need to spend a little bit more time brushing up your skills, referencing, or academic writing, or referencing. And actually give you a place. So basically before this, all of these skills were kind of like sprinkled across all of your topics. And it meant you were getting the skills just in time for that particular assignment, but it was really annoying because you were getting it in 3 different topics, possibly at 3 different times in the same semester. And you were doing it over and over and over again, and we were finding that students were still a bit crappy at it. So the idea was to bring it all into this one topic and make sure that it actually was designed so that you were still getting all of that important stuff at the very, very beginning, so that you had more time to spend on the cool body systems and not on how to write a report, or how to do a poster, or how to do an infographic. That's all in research and study skills. And we had originally, and I'm sure that John's been doing the same thing, reaching out to your other first-year coordinators and saying, hey, what skills do the students need to have to be able to do the assignments that are academic skills? They're not content stuff, but they're going to need them to, are you doing group work? Let's do some sessions on group work. So that's the study skills part. The research part is introducing you to something called evidence-based practice. Does anybody know what that is? Go for it.
Well, I don't know it off the top of my head. But
just give me. Hey, I just got put on the spot here, so I'm ad-libbing as we go anyway.
Evidence-based practice, it's the facts that you learn and that you can show pretty much, but it's factual. It's not a hypothesized thing, it's fact.
Yep. So it's using facts and evidence, yes, that's your facts, your research-based facts to guide your practice, what you do. Yes, what you do. Facts to what you do. When you're a clinician, when you're working in health, when you're working anywhere, that's what you want to do. You don't want to just be flying by the seat of your pants going, I think this is the right thing to do.
It can't
not just vibes.
You want to know that what you're doing, the practice you're doing, the care that you're giving is backed up by the evidence. For us, it's our teaching is backed up by the evidence, and we're always trying new things in our teaching based on what the most recent evidence is telling us. So I've spent the last week, I mentioned, at a conference nerding out about pharmacology and pharmacology teaching so that we could bring it back and trial new cool things in our teaching here. So that's that evidence, using that evidence. But in order to use evidence, you actually need to know how to find it. You need to know how to read it or ingest it. And you need to know how to appraise it. Because, of course, at the moment, TikTok. Is that evidence? Is that facts? It's presented as facts. God knows I get all kinds of them that actually are like, look at this awesome paper that I've just found. Paper does not exist. Totally non-factual. Hallucinated. Where can you go and how can you actually fact check this sort of stuff? Have any of you, because you're all in health, have you had friends yet say, hey, what do you think about this particular health-based something that was on TikTok? I did a year of psychology, and honestly, before I even started, because I was in psychology, I had people going, can you psychoanalyze me? I haven't even started yet. But same thing in health. They're like, oh, what do you think about this? And right now, you probably go, maybe, who knows? In this topic, you'll actually start learning the skills to be able to fact check and find those useful sources, those reputable sources, and use them to support what you're proposing. And it's really what you're doing in your assignments as well. It's what you did at high school when they made you find references and use the references and that sort of thing. It's finding that evidence and using it to support what you're doing, what you're saying. And so we start with that in research and study skills and then carry that through so that by the time you finish, you're awesome at using evidence in your assignments, but even more importantly, you're awesome at using evidence and research in your practice. So it makes you up to date and makes sure that you are doing all the right things. I've talked enough.
That was awesome, though.
Thank you.
Thank you. And just wanted to add to that, when you graduate with a bachelor's degree or a master's degree or a PhD, fellow citizens are expecting you to act in relation to good quality research, in relation to evidence, not just vibes. Right? So this is an expectation that we have of each other when people have tertiary degrees. So it's not just for you and it's not just for your practice, it's also for larger community. Beck isn't here, as I said. I'll just give you a very quick overview of this topic, interpersonal and interprofessional communication. One of the things that is really fundamental to the kind of stuff that Jodie and I teach in 1012 is the idea that it's not just what we do, but how we do it. That's really fundamental. So how we communicate with clients, how we communicate with colleagues, how we communicate with people in different parts of the health system or other systems is really fundamental to being effective for the people that we're working with, on behalf of the people that we're working with, for our relationships with each other. So you might think you're really good at communicating because you're an extrovert. You might think you're really good at communicating because you're known to be kind of like someone who can talk to people at parties. That's a really cool skill and I do not undervalue it. But interpersonal and interprofessional communication is about learning a really key part of what it means to be a professional and what it means to be a future practitioner as well. So it's learning skills. One of those skills is listening. Our culture doesn't value listening very well. So learning how to be an effective, active listener is one of the skills, and it's a really fundamental skill. All of the skills within this topic are fundamental to being a professional and a potential practitioner. So doing that topic, you'll learn lots of fab skills. And Rebecca, who is the coordinator, her whole area of research is looking at evidence-based practice in relation to this. So talking about evidence-based practice, she brings a whole lot of that into her thinking in relation to the topic. Did you want to add to that, Jane? No. Jodie, do you want to come up and we'll talk about 1012? So 1012 is strengths-based approaches to health working with Aboriginal and Torres Strait Islander peoples. Sarah Carrison, who is our colleague, she's the topic coordinator for the City campus and the Sturt campus versions. I'm the online topic coordinator. I feel really proud of this topic. It's like a gold standard topic. It is based in evidence. It was produced in collaboration with an Aboriginal advisory committee, and it's also based on the best evidence that we have. So it's broken into 3 parts. The first part, we look at language and terminology. We look at our own understandings of health and well-being. We think about how that shapes our understandings of what it means to be well, what it means to be healthy, what are the parts of being well and healthy. The next 4 weeks, we look at the Australian context. We look at history in Australia and how that shapes systems, how that shapes structures. We consider colonialism and racism and policies and practices. We also consider racism and colonialism as determinants of health. And in the last 4 weeks, we look at cultural safety as a framework based in theory. Did you want to?
We do also look at the deficit model and how, things like newspaper articles, how they can shape your opinion and whatnot of something, but it's not the actual fact or truth. And how it relates back to like the interpersonal and interprofessional communication, which is, like I said, I think it's week 8 that I come across and help out with, and it's about how your writing or your communication, and this is across all topics, can define someone's care that they will receive or supports that they will receive. And like I said, this is coming from someone that's worked across the sector, with the court systems, that one little word that you might think is like the best word to put in there could mean the difference between someone either being put out on bail or being locked up for 12 months. Or again, NDIS plans, whether someone gets a $100,000 plan or if they get a $10,000 plan.
Yeah. So language and terminology are incredibly powerful tools. And when we are professionals, whether we are clinicians or we work in the health system in other ways, we have incredible power in relation to clients and in relation to systems and structures and institutions. So Jodie's just speaking to that, being cognizant of the power that we have and using that power in ways that advocates for and with the people that we're working with, rather than advocating against the people that we're working for and with. So it's an extremely powerful topic when it comes to thinking about power and ourselves and institutions. And Jane's topic actually talks about that as well. So do you have anything to add to 1012, apart from the fact that it's actually really great?
It's good because I think the things that we talk about in the topic helps you to think outside of the box. To I don't know if you guys have ever heard of like the Herman whole brain sort of thing, where it's like you do this little quiz and it does your personality. It's like you become a yellow thinker. So it's not about coming up and then finding the roadblock and going, oh, well, but this is the way that we've always done it. We give you those tools and knowledges to find the way around the wall, around the blockage.
Or why that exists in the first place.
Yeah. And understanding, Aboriginal and Torres Strait Islander perspectives where, in the Western model, this is how things are, but, in the cultural landscape, it's different. And these are just things that then you have in the back of your head, and it'll improve your practice, not only for Aboriginal and Torres Strait Islander people, but for everybody. Because like we say, if we get it right for Aboriginal people, we'll get it right for everybody else.
Yep, brilliant. Thank you. Okay, we've got Jane. Thanks, Jodie. We've got Jane, and then we've got Hannah, and then we're going to do something fun.
So none of you are doing my topic, but I'll talk about it anyway. Some of you will be back in semester 1 next year to do it if you stay in the BHS. So this is a topic that introduces you to, it does complement very well 1012, to thinking about what do we mean when we say health, and also, in particular, the difference between health, illness and disease. And we start thinking about ways of thinking about health. So when you study human bioscience, you will take what we call a biomedical approach to health. You'll look at inside the body and look at the body as a bunch of systems that work together, and health is largely defined by those systems working to achieve their purpose together. That's a biomedical approach to health. A social model of health looks at things outside the body that affect health. And most of the things that influence the health of us as individuals, but of populations over time, happen outside the body. At the beginning of the 20th century, 10% of all babies born in Australia died in their first year of life. Now it's down to about 4 per 1,000. Not because our biology changed, but because the world in which women experience pregnancy, so conceive and grow a baby, but then also the world into which that baby is born, is so different than it was 100 years ago. So we're sort of in that thinking. So the topic, we spent about the first 5 weeks thinking about the social model of health and looking at how that helps us to understand some of the important health issues that you'll come across in the healthcare system. In the second 5 weeks, we move on to thinking about that healthcare system. So learning about, well, what is it that we think the healthcare system is there for? Is it really a system? We talk about universal healthcare in Australia, but how universal is that? And then start thinking about what does that mean for you as future practitioners when you're going to be out there with all these fabulous skills and the system creates roadblocks to you actually providing the care to the standard that you have been trained to do and you expect to be able to do yourself because you know that's the best possible. And then the final theme in the topic is actually starting to get you to think about your changing identity. So for most of you up until now, your interaction with the healthcare system will have been as a user. Most of you will have been to GPs, you might have used other kinds of health services as well. You might have had a visit to the ED, all sorts of things. Your role, your interaction, your relationship with the healthcare system will change as you become a health professional because you'll also be a provider of services. As somebody who will continue to be a user of services, that is potentially a privilege, but it can create some tensions as well. So we'll start introducing you to the experiences that some health practitioners have had with that, and then we'll also get you to think about, well, now that I've learnt this stuff, how does that affect me as a user of health services? Because we are probably quite different users of health services as people who know a bit more than the average person about health than we were before we started our studies, for better or worse. So that's what that topic's about.
Every time Jane talks about the topic, I want to do the topic. But I don't think that's allowable in my job. I have to teach. I'm learning as well.
You could come and sit in as a student for a semester and then decide.
I could actually, yeah. Okay. Lucky last is Hannah. I haven't heard Hannah talk about the topic, so I'm really interested to hear you talk about the topic. I'm actually handing over, a slightly sweaty microphone.
That's okay. All good, all good. I might first start by asking if anyone's actually enrolled in this topic.
They might do after they hear you talk.
Okay. Yeah, so I'll keep it brief in case, we're not in this topic this semester, but I'm sure you might come into a topic with digital health technologies. So, I'm the TC for Health 1101, and we're going to start really broadly looking at how technology is used in our healthcare system in terms of patient management, databases, collecting information on patients, and then looking at the ethical principles and safety around that kind of collection of information. Then we're going to move into how digital technology is used in healthcare. So in this topic specifically, we're going to look at simulation and gaming technologies, so things like virtual reality for patients with neuro conditions, all based on that evidence of what we've seen to be effective. And I think in this area I can bring in my research as well in the robotics and Ps. That's my passion, is the innovative uses of technology in that real healthcare delivery as a physio. So, if you're not in this topic, that's okay. But as I mentioned before, I am a physio. So if you have any questions, I did do my bachelor's here at Flinders and the master's program here. So if you have any questions about those pathways, I'm happy to help out.
I have a question, Hannah.
Yes.
You were talking earlier about the women's and children's and the...
Yes, it's amazing.
Are you working with the robotic suit, and then there's that game where you've got to like get through?
Yes, yeah.
My son's been in it. So
Oh, awesome. Yeah, so it's called the Hakoma Lokomat, is the robotic assisted gait trainer for your legs. And then they have one for your arm as well. So the child is supported in a harness, they're over a treadmill, and the robotic orthosis moves their leg through a gait pattern. And as that child is walking through their gait, there's a virtual reality screen in front. And so, you know, the virtual reality program makes the penguin jump higher if you terminally extend really strongly, that kind of a thing. So it's really fun.
it's really cool. So if you guys are like, I'm advocating for your...
Thank you so much. My whole PhD program. Thank you. Thanks so much.
Thank you. Yeah.
So if you're interested in physio, you may have enrolled in FIGHT 1001 Intro to Physiotherapy. Possibly, yep. And if you're interested in OT, you may have enrolled in OCT 1001 Intro to OT. Okay, good. So both of those are topics that are intended, and you did health sciences, didn't you? Do you remember those topics? Yeah, the FIGHT topic?
Physio, yeah.
I'm taking the mic.
Oh, no.
Can you remember what?
Oh, no. It's a bit of time ago.
Okay, all right. So, but basically it introduces, both of those topics introduce you to that profession. So what kind of work do you do as a physio? Who do you work with as a physio? What are the kinds of problems that people will come to you as a physio to address? What are the values of your profession? So it's a great opportunity to get a taster of the profession that you're thinking about and be really possibly clearer about whether or not that's actually what you do want to do. Okay, so they can be useful for that purpose. I've already said to all of you that obviously your GPA is the most important thing, so you should prioritise grade over other things, but often it's the topics that you find interesting are the ones that it's easier to do the work and to apply yourself to get the grades.
That's meaningful. Can I add something there? When I started at Flinders as well, that's exactly the process I went through that Jane mentioned. I started with the OT major, and I did topics like Intro to OT, and through that found, oh, maybe this isn't actually where I'm supposed to be. And then when I did like bioscience or anatomy, I really found an interest in that area. So I changed my pathway to tailor a few different subjects, had to do a few different electives to then get into physio. So I actually started wanting to do OT, but followed my passion, and you can easily change. It was very straightforward.
The flexibility is actually one of the strengths of the health sciences program.
Yeah, you're not locked.
It's and you're even less locked in now than probably when you started. Yeah.
And how do you know that you like something if you don't know anything about it? You've got to try it out. I just wanted to introduce this fella that walked in. This is Boris, another of our colleagues. I introduced Boris to other people by saying Boris is really into hearts, because you are. So Boris is part of Georgia and Roweda's team in anatomy, physiology, human biosciences space. And Boris, this semester you're working in nursing, aren't you? But you might see some of these folk later on because Boris is also in the research and study skills too. But we've just introduced ourselves, and I've already introduced you and said that you're really into hearts, but can you tell us a little bit more about that, just so people know what your passion is, what you nerd out on?
Thank you. Good afternoon, everyone. Welcome to Flinders. And basically, I'm relatively new to Flinders as well. I think I started in semester 1, and I sort of started in Queensland. I did all my schooling there at Griffith University, teaching nursing, allied health, and pre-med students, mainly in things like physiology and genetics. And so I guess my interest in hearts is because I did work at the Heart Foundation Research Centre, where I was looking at exercise and how I guess it prevents heart attack and heart disease. after a few years, I sort of moved in towards like the research of disability as well. Like I'm interested in a condition called Ehlers-Danlos syndrome, a hypermobile condition, and looking at not only the genetics of that, but the qualitative aspects of that research, mainly due to a personal aspect. Like my now wife has the condition, and I realized it was the opposite of heart disease. Everyone knows about cancer and heart disease, and then not many people know about invisible illnesses and connective tissue disorders. Here I teach as part of the anatomy and physiology team, and I was in the other room just before with the nursing students because in part we're doing this project to combine anatomy and physiology with the nursing team next year. So what better way to learn their ways than to actually be part of their teaching team? So that's where I was in the last hour. But it was nice to see you all and meet you all, and hopefully we will see each other in whether it's a first year or second year or even honours topics, which I also do as well. Thank you.
And also, Boris, you and everyone else are about to play bingo. Yeah. So we're going to do something which is about getting up and getting around and learning. I'm going to come back to this one. Yay, bingo. This is us here. This is in this building. So, bingo. I've got the sheets and I've got some texters. I'm going to get everyone to get a sheet and everyone to get a texter. And you have to go around and get as many boxes as you can with different person's name. So every box needs to have a different name. And this is an opportunity for you to learn other people's names. Us to learn your names. Hey? Maybe. We might have more boxes than people. I don't know. I'm actually not great at maths. Okay, yeah. Okay. Yeah. Do you know where it is? Yes. Okay. And then you can come back for bingo.
You as well? To know the number for it to add onto.
Oh, wow.
Sure.
Yes.
These are gamers.
Anybody else? You were here for I did.
Oh, yeah, perfect. Thank you.
Run. So that it would probably stop, right? Yeah. Training.
Yeah, and he's only just aged out. What's your name?
Kira. I came on public transport.
Oh, the children. Race away. He's on my table.
We never did.
He's got curly hair.
Yay. I know.
Are you left-handed?
Yeah, we still have our transition. We're going to talk to Dr. Steve.
Yeah.
For that. That's cool.
Some families. I'm going to try and be quick, please. Me! I know that.
Because we're the only two.
You got to look the lighting.
I think Jackie has. I already have.
I do have one. I've already got the Tory.
I actually had 2 in 1 year.
Oh, gotcha.
I was I wasn't in from this. Yes. That's it. Like my family physio extras too. They have a locum Spring term quite privately, and I just wanted easier.
We're talking about in Australia.
Adult size. Skinny, very tall.
Yes.
Okay. Well, but I think I'm still out.
I use Tracy's.
I work at physics.
Tracy, you're left-handed. Okay.
I was born when decided to be
R-A-F-A-Y. Not 5'11". 5'11", I'm telling you.
I don't see A-R-A.
I'm telling you.
You're not. I'm measuring myself. I'm 25. What? I'm measuring myself. Can you juggle?
Oh, no, yeah, I can juggle.
Oh, you can juggle.
Does that count? Yes.
I just like juggling as well.
Try everyone else.
Yeah, I know, but I'm sure someone else can juggle.
She told me I could. I have an older sister. We have it.
Loki, the easiest one is going this way, right?
You dislike chocolate.
That's what I'm. That's
dislike hot.
I do.
You do? No, I'm going to put it down.
to tell.
Noah.
I have an elder sister.
I fit like top of it.
I'm telling you, you need to remeasure yourself.
I'm telling you, I measured myself yesterday. 181.
Okay. Go for it.
Yes.
How can you help me?
Yes.
She's not down your
R-A-F.
She's not down.
Okay. Yeah. I get some.
Oh, I'm ready.
And you said you've got an older sister?
I have an older sister.
Yeah, Tracy can be my
works.
I'm also left-handed. Oh yeah, I've got a bingo. Bingo.
Three.
As soon as you heard that, you're like,
Well, I forgot to put it down. Even though I was like, I'm left-handed. Oh, why? So I've got to get.
Yeah, and I win.
Let's ask you next question. Jane, are you
I do.
And I did it.
Hey, you play an instrument?
I
used to. I don't know if that counts.
It does.
But there is
How do I spell your name?
Yeah.
I am. Oh, Tracy. I'm
Used to.
Cross her eyes and
This is
another
all-
actually have perfect.
G-I-N.
more than one language.
Someone else has to go here. Jackie has
Wow, you
Rowaney's got curly hair, but she's straight.
And I win.
Yeah, you didn't even
I have to talk it in front of you. Exactly. I have to do others.
Noah's got curly hair.
I feel like Noah also hits the 6 foot more than 6 foot. You need to get him. He also hits the more than 6 foot.
5'11" and 3.
He's not.
I counted this morning.
No, you've remeasured
I measured this morning. It could be because of my boots.
I was going to say,
You're like 188.
mine is like half a centimetre off, and he was really upset, and you were taller.
I've measured myself.
So why would I go down? Noah. Why would I go down? Like,
I've literally measured it.
I'm measuring like this guy just gets the one out of the toolbox and measures at the front all the way to the back.
I even
where you want to hit.
It was really gross. Actually, I definitely can't still do that.
That's really hard. What happened?
Yeah. And I can juggle. I
He's the only one trying to put in more.
And then when you were dancing,
Who else can juggle? It's literally just me. Me and you.
Stuff here or not really?
I did it. I know I did it.
health to go. You're a student.
For anyone that talks to A, B, or C.
Where's the end?
I think there is.
What am I?
Well, I'm going to presume it starts with a C.
When I first started working,
It's confusing.
Oh, that means I get the free space. Something unique.
And I went. You could be a Siobhan.
I get Sierra a lot. I'm like, just think of Shakira.
I'm teaching.
So if you want to get some
relatively
my oldest, we wanted in Llewellyn, but we wanted to call him Ty. And I told my husband we weren't allowed to do that because nobody would be able to spell or pronounce either of his names. So he's also. Well, I was in the middle.
I'm the youngest of three.
Why the spelling needs to go
All Irish.
Why do you?
They're not like names. They're like BH. It's not the Midwest.
What was your
What
was your free?
Zoe wanted to call Zoe here.
I can put anyone in. I can put anyone in.
You have to think about it.
Yeah, I'm deciphering.
What's a free one?
Free is like anything. So like
For something that this person has that nobody else or nobody else.
Oh, that's not free then, is it? Oh, you got your own name.
like a square in Scrabble, you can make it any
I live in Mount Barker, so it's sort of kind of
Where is
the same, like Flinders and here.
That's really interesting.
And I'm probably the only person.
Only person named Jane.
in this room.
That's interesting to know.
But no, next level.
Yeah.
Like who else here speaks another language?
But isn't that already a thing? That's not a free space.
It's already a thing.
Yeah, that's already
But what about what
I want to
language
live
do
in
you
the hills.
speak?
Arabic.
Arabic.
So who
That
speaks
is-
Arabic?
That is next level. Yeah, but that's like on the strike.
I'm the oldest of 8 children.
Not around.
Hey.
Everybody
Add in another name. Well, I'm going to do that for Jane.
Whereas
It's quarter acre plots.
Only had to do something.
Torn a ligament. Torn a ligament.
Do you actually think that that's a
copy that slide, so.
Like torn, like not ruptured, like fully torn.
I just think maybe in this room.
I was the only person in the room who's
Yeah, actually, that makes you special.
You don't feel special right now.
What's
Like south. Oh, Woodside.
What do you think other people here might
Bridgewater.
Oh,
I've done both my ACLs.
That is
That's pretty impressive. That's why I got into physio in the first place. Like, like my whole high school I wanted to be engineer.
Going up a
My
bit
dad.
past Bridgewater.
And it was only up until stage 2 where I was like, maybe I wanted to learn about injuries, but I was already into engineering.
That's the
But I
dream.
can't go back now.
relational.
Engineering?
Wait, it never says you can't
Yeah,
be yourself.
but physics is like,
Physio's engineering
Never says
for
you
the
can't be
body.
yourself.
physics is like more math.
No, you've got biophysics as well.
Your dad, you are actually dad adjacent.
He wanted, because he had like a company and then Telstra bought it. So he wanted me to run that and he's like, you be electrical engineer. And then he, like the whole high school, he made me do like specialist math methods and methodology. And then I was like, it was only up until my second year, I was like, I'm leaving this. This is not for me. And then he was so upset. And I was like,
Actually, I think you're more like your dad than your dad sees. Because if you're interested in physiology, physio, they are so engineering, which is what we've all just said.
Especially if you go into the mechanical.
That would be cool.
yeah, that's, I think that's the only part I would get into the engineering aspect, the digital
What the
part.
home sold for.
But my son's.
But you've got your body.
Yeah.
He's biomechanics.
It's like 300,000. 22.
Sorry. Your physics and chemistry,
You
sorry.
and Sam Kerr need to have like a
Sam
a
Kerr.
WhatsApp.
Sam Kerr, like the
Yeah,
the soccer
for
player.
ACL injury
Yeah.
group.
Yeah.
I'm sure you're not the only two related injuries.
Yeah.
Sam,
Keep raising it.
going.
Yeah, that's it.
So which sport did your knees?
Basketball, but my main sport is tennis, which is when I did my other knee. So,
Sports.
Yeah. We're getting pushed out of rent because it's actually getting
What I was going to. Oh yeah, my son's doing biomedical engineering, which you can do here as well at Flinders, and he's all about the bio and the physics. That's why he's doing it because they're like the melding of his two favourite things.
yeah.
So Anyway, we need to get back to a little bit more talking. Well done to the people who got. I actually owe you all highlighters, and I need to get them to you because I don't have any of them today. So I'm going to have to get names of the people who all got 5 in a row and get some highlighters to you somehow. Maybe through Rowena. Maybe through Rowena. I'll give them to Rowena. I'll give the prize winners to you because you're going to see them doing human bioscience
on Thursday.
Okay. So let's get everyone's name. Okay. Can you put it on the back of here if you've got a line, and then I'll get them to. Thanks.
Can I make this up, Noah? Do you dislike chocolate?
I hate chocolate.
Okay.
Oh, you were so fervent.
Dennis, hear me
made it up.
I used to like it until I was 6, and then I just like
You're a unicorn.
15 minutes.
What do you like, Lisa?
Okay.
Do you like sugar?
Yeah.
Do you like cake?
What is it about chocolate?
You get a whole
It's all right.
sugar person.
The only thing I don't eat is carrot.
Okay.
You like me.
Yeah.
Are you like a
I just eat anything.
Just
not chocolate.
Mistakes we'll never make again.
Okay.
you want one too? Come on.
I'm actually upset. I'm measuring. I have to finish. There's no way. My whole life. No, you've been lied to. You literally said, like, trying to guess my 6'3", and I always I'm telling you.
Very flexy, that's true.
So maybe I'll do as much as I can.
I always thought you were 5'10".
Yeah.
Which one? I'm telling you, 5'10".
Sometimes.
That is 4 centimetres.
Yeah, it's really good. Yeah. I just want to show them around a site. Yeah.
That's probably what I would probably.
Yeah.
They do marking.
Interested in how they make
That amount of money.
Why didn't you say that?
Yeah, why didn't you say that in the secret panel part?
You should have told us that for the free.
What you were just saying to your... Hey, that is extremely cool. That is extremely cool.
There's no way you can do it. Done?
Wait, look at this.
Having you, then like,
5'11", but that's 6 foot.
We're just going to spend a little bit of time looking at a flow site so that when we talk about Flinders Learning Online or Canvas, you've got a sense of what one looks like. This is 10-12, which I'm not sure any of you are doing this semester, and that's okay. Jodie and I do not take it personally. Done. Some of the... Yeah, that's true. We won't be insulted if no one's doing 10-12 this semester, is what I said.
Oh, yeah, we've got heaps of students already.
We have 500. So I'm just going to show you what a site looks like. And I chose this site because it's the site that I'm most familiar with. So this is what this is what a flow site looks like. So this is what most of the sites will look like. See this banner down the side here? This is going to be common to every site. There might be some things that are a little bit different.
It's called So the dark blue is called the
navigation menu.
Global navigation menu.
Sorry, yeah.
And then the white column next to it with the blue writing is called the topic navigation menu. So you might see those written in information. That's the difference. So if you're on the list with the white column with the blue lettering, when you click on things, there'll only be things that are relevant to that topic. When you click on the tabs in the blue column, the icons in the blue column, then they sit above your individual topics.
And so this is what it looks like for me, which is different for what it's going to look like for you, because I am not a student. Yeah, I'm going to look at that in a minute. Thank you, Jodie. I just wanted to show you, because yesterday when I was a student, I couldn't see the readings, which was annoying. But I just wanted to show you, this is how you get... So when a lecturer says, have you done your readings, and you don't know where they are, that's going to be a difficult thing for you to achieve. But the readings are linked to each week of the semester calendar. And so in our topic, we have one pre-reading, which is just a 2-minute video about a really beautiful artwork called Yarra, which is about the combination of Ghana knowledge and Western knowledge, and it thinks about how feathers are representational of quills, and feathers are also representational of the sky and the earth meeting, because that's what they symbolise, and it's about the collection of feathers creates something greater than the feather on its own. So I'm just going to show you what they look like from week to week. So in our topic, which is going to look pretty similar to your topics, you've got readings, and you click on those readings to view them. So you say, yes, I'm going to do the right thing. I understand copyright legislation. And then it takes you to the reading. Now, if you're old school like me, you will print this out and then write all over it, because that's how I study. But if you're new school, like many of you might be, you might just download this document and annotate it. And you can see up here, you can download the document as a PDF. And then you can annotate it using your iPad or your computer, your laptop, whatever means. And that's a really great way to start making notes. So what you're doing, you're developing some skills to become a student, and all of those notes that you make are actually going to support you for all of the assessments you're going to have in the topic. So knowing where your readings are is really important. See how these ones are required? That means you're expected to do them for that week. Other weeks might just be recommended. So you've got here required. This one isn't required, but it's just something that you might want to look at if you're really interested. So I'll just look another week and see, because they might have some recommended. No, these are all required. Gosh, we have a lot. Ah, thanks, Jane. You noticed that. Yep. So that means you don't need to watch it, but it's recommended that you do. So that's readings. When you first come to a site, you'll land on the home page, and I'm going to go to student view now. Not now. Okay, done. And it will have announcements. Often topics have 3 announcements pinned at the top, and those announcements that are at the top are going to be the most recent announcements. This can be a good place to come to look at things that are happening at the moment. I remember Roweda said that she makes announcements the week before about the coming week and all the things that you need to know. So that's a really good place to go when you want to do some preparation. In this topic, and it might be the same in other topics, the announcements might be something like, make sure you're preparing for this, or it might be, grades are going to be released on this date, ... So all of the announcements are about what you need to be doing in relation to the topic around that time. But let's go to the modules, because the modules are where the content is primarily stored. So one of the scholars was saying, Charlie was saying, they got an email about week 0. Most topics have a week 0, and these are just places where you can come and orientate yourself with the topic. And then we start with the content. And you can see here we've got, what did you call them, Jane, yesterday? There are a few banners that you see across the topic. So week 1 is a banner you'll see across all topics. Learning content you'll see across all topics. Applying your learning is another banner that you'll see across all topics. But this is in this topic, and it's going to be very similar across all of your topics. This is where you find other content that you need to be across for your weeks. So if you're going to a tutorial, say you're going to a tutorial on Tuesday, it's expected that the day before, on the Monday or the Sunday or the Saturday, that you will have looked at these short videos and activities in preparation for the tutorial. And then we've got most of the weeks published here. You don't need to really concern yourself with all of the weeks to come. Just really concern yourself with the week that's coming and the content that is in relation to that. We don't have the assignments available yet in this topic because they're being reviewed, and the first one will be published on Monday. But we can show you a little bit about, here we go. Every topic will have information about when assignments are due, the length of the assignment, and whether or not you can use artificial intelligence tools in relation to the assignment. So this is the kind of thing you might want to put down as part of your key dates, because you might find that some topics have assignments due on the same day. You might find that topics have assignments. So, you know, one assignment from one topic will be due on the same day of an assignment in another topic. So working out those key dates now is really important, just so you've got time to lead up to them. You can, via the extension request portal just here, ask for an extension. And the reason for that extension may be different to someone else's reason and different to a reason that you've had before. The university currently has a practice or a policy even, I'm not sure, or a procedure. An understanding that you can ask for a 3-day extension without needing any evidence. So you don't need a doctor's certificate, you don't need any other form of professional letter. You can just ask for a 3-day extension, and you just make that request through the extension request portal. If you have a disability access plan, or you may have a medical certificate, or you may have a letter from a professional that allows you a bit more time, when you make an extension request, you upload that evidence to request for a longer extension. It's really normal to ask for an extension. It's kind of one of the most normal things. The 3-day extension gives you that little bit more wiggle room. If you need an extension because of unforeseeable circumstances and you don't have any evidence, email the topic coordinator and say, this is what's happening. They might say, okay, ask for an extension, use this email as your evidence. Or they might say, put all of that into the extension request. But as we said earlier on, it's really important to advocate for yourself earlier rather than later. It's better to say, this is happening to me right now. I think it's going to impact my ability to hand up an assessment on time. Better to do that than do it afterwards once the due date's passed, if at all possible. What else do we want to look at here, Jane? Discussions? Yeah.
And there is also extension requests. They're probably the thing, where you can find information about assignments usually.
Yeah. Hannah's got a question. Yeah. Oh, yes. Here, have the mic. Because we are being live streamed, I think.
Amazing. I just wanted to add with the extension requests, they are very useful, but then do keep in mind that your feedback from your tutor or assessor is likely going to be given later.
Yeah.
So, yeah. And that feedback is often useful for the next assignment, so just keep that in mind.
We do prioritise assignments to be marked by when they were submitted, just as a way of setting up our processes for marking. So great point, Hannah. Thank you. In 10-12, we have discussions for the 3 assignments, and this is probably where we get most of the discussion happening in this topic. And you can ask any question about the assignment. Often you'll go in there and find that the question that you've asked or want to ask has already been asked and answered. So it's a really great forum for finding out those things that aren't clear to you necessarily in the assignment instructions. I know in other topics they'll have discussion forums where you just introduce yourself and tell people a little bit about yourself. We don't have that in this topic, but that is something that you can see in other topics.
Mainly online.
Yeah.
Because this is an on-campus topic that will happen in Toots.
Yep. And from the home page, most of the home pages have these buttons that take you to different places rather than necessarily going through that menu. Sarah has put together a roadmap that just tells you what we're doing across that first module that introduces you to the topic, and then the blocks of modules, and these blocks are made up of 4 weeks. So 4 weeks for that block, this block. And so that might not be the same on each site. They might have another way of talking about how we're going to do the curricula across this topic. Any questions? There's a lot of information. You're not expected to recall it. In fact, if you're not sure, ask someone. Not just level 2, which sounds like a really cool place, but the topic coordinators, your tutors. Maybe a peer will tell you something, but you might just want to clarify whether or not that is exactly true with the topic coordinator and the tutor.
Don't get your advice from other students.
They might be able to support you to problem solve, but they might not have the actual truth because we're all learning together. So Jane has asked for just about 15 minutes for us to do some other things.
So because pretty much everyone in the room is thinking about OT or physio or either or both of those, I just wanted to talk to you a little bit about how the BHS integrates with the Bachelor of OT and the Bachelor of Physio, because they're the two in particular. Oh, and speech. Because that might affect the topics that you're taking this semester. So your primary concern needs to be getting the best grade you possibly can, because that's the thing that's going to get you into the program that you want to move into. If you're choosing between 2 topics that both look like they're promising in terms of grade, you might also consider or give preference or weighting to one that you can then get credit for in the Bachelor of OT or the Bachelor of Physio or the Bachelor of Speech Pathology. So these 3 topics, so the Research and Study Skills topic, Human Bioscience and Strength-Based Approaches to Health, are all in the Bachelor of OT, the Bachelor of Physio, the Bachelor of Nutrition and Dietetics, and the Bachelor of Speech Pathology. So if you pass those in Health Sciences, you'll get straight credit for them in those programs. Obviously, you're all doing this because you must do it. And I think most of you have selected Human Bioscience. Whether you do this or not depends on whether you think it plays to your strengths. But if you're choosing between this and the nutrition topic, for example, you think that in terms of grade they're exactly equal, you might consider doing this because you'll get credit. But don't choose these topics just because you'll get credit. I see a lot of students choose topics because they'll get credit, and the example has been first-year students doing second-year topics because it's in paramedics, for example, and they don't get the grades that get them into paramedics, so the credit is useless. Then if you're going, so they're the only 3 that you can get in credit for in nutrition and dietetics and speech. For physio, and I don't think anybody's in the communication topic. Okay, so if you were to do the communication topic and introduction to physio, you would get credit for 1 additional topic in the physio program. So in our program, these go into much more depth than you go to in the actual physio program in first year. And the same with OT. So you are definitely on the right track with these. Just make sure that if you're not doing this, you've made the decision based on what's your best topics for your GPA. So is that advice about topics and thinking about GPA versus credit clear? So I think all of you would have got a letter from me if you were enrolled on Wednesday last week, inviting you to come to the session today. And in that letter, there's an email address to contact me, healthsciences@flinders.edu.au. So if you have any questions you want to follow up, if you want to check anything with me, I really strongly recommend that you send that email as soon as you can, so that if we need to make any changes, or if you need to think about changes, you've got some time and you can do it before you invest too much energy in a topic that you might change.